right, welcome everyone. Thank you for joining our Ask the Expert interview series. We are so happy to have Shelly Snyder on with us today. She is from the Trust for Life, and she also works with CODA. And because April is National Donate Life Month, we wanted to get her on here and talk all things about organ tissue and eye donation. And so thank you, Shelly, for being on here today. I'll give you just a little bit to kind of give a background and history of your work and what you do.
Absolutely. I'm so excited to be here and talk about this amazing mission of organ tissue and cornea donation. I am the executive director of the Kentucky Circuit Court Clerks Trust for Life, and I also serve as vice president of strategic partnerships for Kentucky Organ Donor Affiliates, or CODA. It's really amazing because both of these organizations have worked hand in hand for decades. The Trust for Life really has always focused on education about the vital need for everyone to support the mission of organ donation and register as a donor. And CODA, of course, has always prioritized public education and then also does all the work in the hospitals, working with families through the entire process of donation. So we are now joined in this wonderful strategic partnership, and I have the honor to work with both organizations. And both were inspired by those who are waiting for life-saving transplants, and of course, honoring those who gave the gift of life. So the circuit court clerks started this program back in 1992, and it was because there was a circuit court clerk who actually lost a loved one waiting for a heart transplant. And when all of the circuit clerks got together, they said, let's see if we can do something about this. Let's see if we can help people who need transplants by asking if anyone would be interested in donating $1 when they got their driver's license to public education. And there was a different circuit clerk right there in that room whose loved one had recently become a donor. And within their family, they had cornea transplant recipients and donor families and so many people impacted by this mission that of course, everyone got on board. And that's how this all started, with the public education focus and the driver's license really driving the registry.
Awesome, thank you. Are you all doing anything special this month throughout Donate Life Month to kind of promote and get the awareness out there?
Absolutely. And of course, with COVID and the changes in our typical day-to-day routines, we have turned so much of what we do to virtual. And so anybody who's interested can jump on our social media and learn what the project of the day is, whether it's dressing in your favorite blue and green pajamas and taking photos of you and your kids and your dog, or doing something just right at home or through social media to promote the message. That's what we're doing this month. It's really incredible how social media can make such an impact. It's absolutely that trusted resource that people look to when they're going to make a big decision. And a decision about organ donation is certainly a big one. Although it's so easy to join and everyone knows it's the right thing to do, sometimes it takes learning about the mission through someone who has received a transplant or someone who has given. Social media allows people to share those stories, which has been really, really powerful. But we encourage everyone, if you're a registered donor, share with the world that you are a registered donor, that this matters to you. And your 100 or 200 or 10,000 friends that are on social media will listen to you, and they'll do some research and hopefully they'll join because you inspired them. So social media is a great place to share your story, share that you're registered, and really encourage others to do it too.
Yeah, that's awesome. So what are other local organizations that are involved with you? I know you had mentioned CODA, Trust for Life. There's also the iBank here in Kentucky, and then you also work with hospitals, coroners, just some other entities that kind of come together to help promote this. And can you explain kind of how you all work together for this mission?
Absolutely. It is really an incredible team of people that allow organ, tissue, and cornea donation to happen. It does not happen on its own. And it is the collaboration between those who register as an organ donor, those driver's license offices that register people every day and educate about the mission, and then to the donor hospitals who call when someone has passed away and could potentially be an organ tissue or cornea donor, through, as you mentioned, the coroners and the medical examiners and different people who are involved in this process to make sure that we are ensuring that those deaths are reported as they always should be. If there's ever a coroner who has questions or needs something specific, CODA, of course, works with all the coroners and medical examiners to ensure that they have everything they need, even if it's a donor case and they need some information on their side. We work closely with them to make sure that that's all possible, and an autopsy and everything like that could happen, with donation, of course, being possible. And then, of course, it's those incredible donor families who really say yes. So everyone works together. We are doing a really cool thing this month in April where we're all raising flags on the exact same day at the exact same time in the same hour, in order to kind of in solidarity celebrate those who have given the gift of life, celebrate those who have received, and of course, remember and continue to fight for those patients still waiting. We've got about 1,000 Kentucky kids and adults waiting on a life-saving organ transplant right now, and many more waiting for tissue and cornea. So we need to continue to get the word out and work together to save their life.
Yeah, yeah. So going in, with that information, how or where can someone go to sign up to be a donor?
Absolutely. It's so easy. So the number one way that people typically register as an organ donor is when you get your driver's license, which is wonderful. And we certainly want people to do that and get that little heart on their license to proudly show that they're registered. But you don't have to wait to get your driver's license. And as there's changes within the driver's license system, we don't want people to wait. So you can jump online any day, registerme.org. It takes like 2 seconds. There's no medical questions, nothing like that. It's just a name, address, birthday, and it registers you. Super easy. You can also even do it through your iPhone, your Apple iPhone. On your health app, you can just toggle organ donor and you can register that way. It's super easy. And what it means is it's really just joining a list, a confidential list. I want to make sure that everybody realizes it's a completely confidential registry that no one would know about until you die if you choose not to tell anybody. But it's just saying, hey, when I die and I'm 300 years old, if I could save a life when I'm gone, I'm willing to do it. Not all of us will be able to donate when we're gone. Being able to donate depends on a million things, but everyone can register. There are no limits to registering. So all you're doing is simply signing up to say, hey, if I could, I would. I'm willing to do it if I can when I'm gone.
Awesome. There are some organs that can be donated while living. So can you kind of go a little deeper into that on, what we might not have to wait for to donate if we have a loved one that is in need of something?
Absolutely. And where you want to find out more about that is working with our wonderful partners at our Kentucky Transplant Centers. So we have 3 transplant centers in Kentucky at University of Louisville Jewish Hospital, University of Kentucky, and Norton Children's Hospital. And these are the places that you will go and reach out to if you're interested in donating while you're living. So you work directly with those transplant centers to ensure that you are a match for the patient you're interested in, or if you're just interested in donating to anyone that you're a match with, that they'll work with you on that too. So there's a lot that goes into that. I don't work with the living donation side as much. My gosh, it's such an incredible gift. And so it's something that obviously we work with a lot of our recipients and volunteers and people who get involved were saved by a living donor. And it's so important that people consider that. And it's also something they should be very, very proud of, to be able to donate while you're alive. Unfortunately, not all of us can do that. And unfortunately, not every organ that's in need has an opportunity for a living donor. So for instance, we had a board member whose daughter was born and immediately needed a heart transplant. And as any mom, her immediate reaction was, take my heart, let me save her. And of course, the doctors won't do that. So there was nothing that she could do to help her daughter, but wait on the generosity of someone else to say yes and save her daughter's life. And so I think it's really important that we put ourselves in that situation and think, man, if it was someone I love who needed a transplant, I'd want them to get it. And sometimes we can control that through living donation, and sometimes we can't. And so, but we can all give hope and just register ourselves and say, if I could help someone in my family or someone out there, I'm willing to do it.
So upon death, what can be donated? Kind of maybe some things people don't realize can be donated.
Sure. So our major organs can be donated. So heart, liver, kidneys, lungs, pancreas, small intestines can be donated, often to children. We also have tissues such as heart valves and different skin, bone. And this is absolutely incredible. In fact, my mom recently had spinal surgery and was able to have this incredible surgery thanks to a donor who had given the gift of tissue donation and allowed for her spine to be fused back together, which the doctors absolutely needed in order for her to be able to walk and run and live her life. So I can firsthand state the power of tissue donation. And then of course, corneas, which is such a gift to give someone who is unable to see. And imagine not being able to see, to drive, to work, to do the things that are so important to us. And that someone else's decision to say yes gives the gift of sight back to someone. So those are the major organs, tissues, and then of course cornea.
Perfect. So should someone who wants to donate after death, should they express their wishes to their family, or is, having that driver's license and that registry good enough? That's going to get them through, or do they need to make sure to tell their family or loved ones their wishes?
Well, registering as a donor is the most important thing. So when you register as a donor, it is very much like a will, that your wishes will be able to go through should you be able to donate. Of course, we always encourage people to talk to their family about all of their end of life wishes, because that is a very difficult time, and to ensure that your mother knows what your husband knows and your children. And I mean, it's so important to talk about that stuff. And I know it's not fun, and people don't feel like this is something they can find the time to do or prioritize. But having been someone who has been through loss, it is very, very challenging at that time. And knowing what your loved ones wanted brings peace and comfort to everyone involved. So absolutely talk to your family, but you can register as a donor, and that's your wishes will be fulfilled. If you possibly can become a donor, if you're registered, you will.
So are there any things that could keep you from being a donor? If you've had any, what are some possibilities of things? Because I know not everyone can donate everything. So
yeah, so the number one thing we always say is don't assume you can't donate, right? Because it's incredible the research that's going on and the changes that are happening, that people who maybe couldn't have donated 10 years ago can donate and save lives today. So we always tell people register, and then in the rare chance that you die in a way that you can donate, let them decide that at the time, right? Because it's hopefully going to be 100 years from now. So who knows what research would have made possible by then. But the biggest challenge is just kind of the way in which people pass away. So in order to be an organ donor, someone has to die in a hospital, typically of a brain injury. It's very specific that their organs are still able to be transplanted because they have died. And of course, when we die, sometimes organs are not healthy enough to be transplanted, or after a major injury or accident. So a lot of things have to line up in order for our organs to be transplanted. But that's what we tell people, let them decide that, let the experts decide that at the time of our death. But you can just certainly register to say, if I could, I would.
Yeah, perfect. I know you mentioned our number earlier, but do you know how many people are in need of donation here in Kentucky?
Yes, so over 900, almost, well, hold on. It is, let's think, the exact number when I last looked was 960. So over 900 people, almost 1,000 people here in Kentucky are waiting for a life-saving organ transplant. Across the nation, over 107,000 people are waiting.
Wow. How are the organs, tissues, corneas, how are they selected for recipients? People who pass away here in Kentucky, are they going to local patients, or is it a national database? Kind of how does that process work?
Sure. So yes, when someone is, the way it happens on the recipient side or on the patient's waiting side is that they work with their physicians and doctors and learn that heartbreaking news that the only thing that's going to change their life and save their life is going to be a transplant. And so then their name is added to a national waiting list. And they're told to wait, right? Have their phone on them at all times, have a bag packed, because they never know when they're going to get that call. They can't travel far distances. There's lots of limitations and they're not feeling good. Some are already in the hospital and waiting. So that's kind of how their side goes, that recipient side. On the donor side, what happens is when a patient dies and is able to be an organ donor, we as CODA, the clinical team that's working there with that patient, with that donor patient, runs a list of the best matches. And these matches depend on many things, and they run that national list. So it's the size of the donor patient with the recipient patient to see if they would be a match. There's blood type, there's location, whichever is closest within the allocation system, but the closest to the donor who are the sickest of the sick go to the top of the list. So those are some of the factors that add in. So it's location, how sick the patient is, their size, their weight. Those are the things that are looked at to find that perfect match, including their blood type.
I know it varies so much depending on the type of donation, the organs, and everything. So how many people could be helped by one person choosing to donate life upon their death? So how, kind of best case scenario, if I pass away, I can help how many people?
These days, it's absolutely amazing. Over 100 people can be helped through the gift of organ, eye, and tissue donation. Tissue donation has really allowed for so many people to receive that gift of life. People like my mom, like I mentioned, who received that spinal fusion because of that donor bone donation. So it goes far and wide. So it's absolutely incredible. Over 100 people from all over the United States can be helped.
That's great. That's awesome. So I understand that you have a personal experience with donation. So I just wanted to ask you to take a few minutes and kind of share your personal experience with it. I know you've worked for the Trust for Life and CODA for many years. So professionally, you're very well versed in it and know all about it, but I want to kind of get your personal side as well, if you don't mind.
Sure. Well, and it's such an honor to get to share. My father passed away very suddenly when I was 17 years old. He had gone upstairs to take a nap, said he didn't feel real good, but it was just a summer day, and just figured he would take a nap and feel better. And tragically, he died. We don't know why. He was young and healthy, 49 years old. And my mom and sister are both nurses and did everything they could to save him when they found him. And by the time he got to the hospital, there was just no chance, no life. And my mom just remembers it being the one moment of light in a day of complete darkness for our family when they asked if my dad would be interested in being a tissue and cornea donor. My dad was a big basketball player and coached all of our basketball games. And I can remember standing at the funeral and telling my friends that I played basketball with that dad's helping someone else play through the gift of his tissue. And I learned later that his corneas gave sight to a 22-year-old and a 29-year-old. So I have been so proud to still get to share his story, still get to talk about him, introduce him to the world, even as it's been over 20 years since he's passed away. I still get to talk about him and be so proud of his legacy that he left. And when you're going through a loss like that, sometimes it just feels good to have something to share, something that's going to make a tiny bit of good come out of something so tragic. And so my family was very lucky that we were able to be a donor family. We feel very fortunate to have the arms that wrapped around us in our aftercare program at CODA, the grief support, meeting other families who have been through something similar. It's just meant so much to us to be able to continue to share, continue to celebrate him, and to know that he's still making a difference. It's interesting. My older sister had received an ACL, had ACL surgery, and at the time we didn't know that was a donor tendon, and then my dad donated his, and so it's just been kind of a full circle thing for my family. But we're all so proud and love this mission, and I'll do anything I can to help those still waiting, because I know how it feels to suffer through those losses, and I don't want any family to lose a loved one waiting on a transplant. So we're shouting it from the rooftops, anything we can do to get people to love this mission and say, yes, it's going to help so many people.
Yeah. I appreciate you sharing your personal story with us, and you touched on this during that, but I wanted to ask if there are some resources for family members who have, just experienced a death in the family, and any partners that you can recommend for them to reach out to.
Absolutely. If you jump on our website at donatelifeky.org, we have a lot of resources for donor families. Some of the things, we have a donor family coalition, which specifically is a large group of donor families that work together, lean on each other. They help inform what we do at CODA, and we get a lot of feedback from them. They also connect with other families and share their journeys with each other. We have emails that we send out that constantly providing different grief tips and resources. We have virtual support groups that we're putting on right now. Every year we have a donor family recognition ceremony to recognize and honor those who have given the gift of life over the past year, and those prior to that as well. So many opportunities to engage with people. There's also resources on there for different local support groups wherever you are, if you'd rather meet in person. And there's also an opportunity, if you have given the gift of life, if your loved one has given the gift of life, and you would like an update on how their recipient is doing, say, even 5 or 10 years later, that I'd like to know how my loved one's kidney recipient is doing. There's a place on our website where you can type in your information, and we can do some research to get back to you on how that recipient is doing. So there's some really great tools on our website that I'd love to direct people to.
Awesome. Thank you. I think we are pretty much done with our questions. We're kind of wrapping it up now. Just wanted to ask if there's anything else that we didn't touch on or that you wanted to share with us before we leave here today. And again, thank you for your time. So I'll just let you kind of wrap it up with whatever you'd like to add.
Sure. Well, I mean, we covered so much, and thank you so much for giving us the opportunity here. I think the number one thing that I always just like to remind people is that everyone can register as a donor. There are no limits to registering. So many times people assume they can't, or they think, I've had this medical history, or I can't donate blood, and I don't know if I can donate organs. Everyone can register. And just that act of registering gives hope to thousands of people waiting. So that would just be my one thing to say, is that if you're looking to do something really good today to make yourself feel really good, and to know that you are offering the world some love and kindness, register as a donor, share it with others, share it with your family, and share it on social media. The more people we can get registered, we will be so happy to see that this wait list ends. Currently 22 people die every single day waiting for an organ transplant. So every single person that registers has the chance to change that number, and that's certainly what we want to do. So thank you so much for having me. It's been such a joy, and I hope if there's any questions or anything else I can answer, jump on our website at donatelifeky.org, reach out to us anytime, and we'll get back right away.
All right. Well, thank you so much, Shelly. Hope you have a wonderful Donate Life month. I don't know why the echo is going on, but thank you very much, and we will see everyone later.